Nursing student Stephanie Lipscomb was only 20 years old when she started to experience extreme, persistent migraines that prevented her from eating, sleeping, and even dressing herself, as she describes in an ABC News interview dated July 18, 2015. She went to the doctor, had a CT scan, and was told that she had a glioblastoma multiforme tumor, or GBM, approximately the size of a tennis ball behind her right eye. She underwent numerous surgeries over the next 6 months, and her life was turned completely upside down, until she met Dr. Anif Desjardins at Duke University's Oncology Center. Today I will be telling you about a revolutionary new treatment to eradicate tumors, specifically GBM tumors, with an injection directly to the tumor of the poliovirus. First, let's look at how, think about someone you know who has cancer or has battled cancer, any form of cancer. If they're already making these developments for brain cancer, they are making developments towards treating other types of cancer as we speak. Every year, 12.7 million people are diagnosed with cancer, 15,000 of them with brain cancer. Today, I will be telling you about how a tumor is diagnosed and the current treatment options. Then I will tell you about the new treatment option and how it works, before finally taking a look at the future implications for cancer research. First, let's look at how a brain tumor is diagnosed and the current treatment options. From a June 3, 2015 article from a nonprofit hospital outside of Los Angeles, Cedars-Sinai, they recognized that most malignant brain tumors travel to the skull from other parts of the body, making them very hard to treat. Additionally, from the same source, they say that most brain tumors are benign, which means that they are not growing. However, some of them are malignant, which means that they're extremely dangerous and growing by the minute. According to an article from the American Brain Tumor Association dated December 1st, 2014, only 4 out of 10 regularly used treatments for cancer apply to brain cancer, which emphasizes how hard these cancers are to eradicate. Since what we're talking about today is specifically glioblastomas, let's take a closer look at what they are. They've been recognized by the American Cancer Society as of January 7th, 2015 as the most dangerous form of brain tumor. For a relatively young person, aged 20 to 44, there is a 17% chance of survival. This drops to 4% by the age of 60. Additionally, the median survival length for someone who undergoes chemotherapy and radiation with a glioblastoma is only 14.6 months. Next, let's look at this re-engineered poliovirus and how it works. According to the Wall Street Journal dated April 23, 2015, scientists at Duke University have been researching this since the year 2000, after preliminary research was done by Harvard University in the year 1991. According to Duke University, they genetically modified the poliovirus into PBS or IPO, which involves removing the part of the virus, the gene in the virus, that causes the disease of polio, and which turns it into a natural cancer fighter, as brain cell cancer tumor cells have an abnormally high number of receptors for the poliovirus. The virus attaches to these receptors, and the immune system recognizes that it's supposed to kill the virus cells, in turn killing the cancer cells. It's hard for the poliovirus to travel too far through the brain because it's a relatively large molecule and the brain cavities are too small. According to a March 29, 2015 episode of the talk show 60 Minutes, that profiled Stephanie and her tumor, they say that her tumor grew for 2 months, which was just due to swelling from the immune system attacking the cells, before it shrank for 21 months, and then the tumor disappeared completely. According to Dr. Fritz Anderson, who was the second cured patient from this trial, he says that I feel I'm cured. It's weird to see these results from a relatively low-grade phase 1 clinical trial. Lastly, let's look at what this new discovery means for cancer and for cancer research. Duke says that this treatment has the ability to work on other cancer types. According to the ABC News interview mentioned earlier, they are hoping to soon make this treatment applicable to melanoma, or skin cancer. According to the Gromier Laboratory, which is the laboratory that developed the genetically engineered poliovirus, it's still researching how and why exactly these cells are able to attack the cancer cells so well, and they're hoping that will make it easier to treat other forms of cancer. Also, they are hoping to be able to use other diseases, not just polio, to treat cancer. HIV and smallpox both have a similar viral makeup to polio, so they are looking at being able to use those diseases. However, they have to make sure that the viruses will not revert back to their wild form and cause nerve damage for the patient after they are genetically modified. Today I told you about the diagnosis and common treatment options for brain cancer. Then I described to you a new treatment option and how it works, before finally looking at the future implications of what this means for cancer research. According to scientific writer June Goodfield, if you want to understand a tumor, you need to be a tumor. So I guess you could say that scientists' interest in tumors is malignant. It's growing by the minute.